welcome everybody. My name is Alex Goldsmith. I'm the CEO of Medigold Health. I'm joined by Gareth Williams, my colleague and Chief Medical Officer, and pertinent for this conversation, an ex-GP. So hopefully we'll be able to navigate our way through these latest changes to the FitNote system, and hopefully tell you some things you didn't know, and maybe make some things clearer for you in that regard. A bit of housekeeping. There's going to be, I think Nicole's got the ability to change the slides. So that's going to mean me saying next slide, please, a bit like in sort of Chris Whitty style, but I don't know, because Gareth's the doctor, so that might make me Boris Johnson, in which case let's not say it's in that style. But anyway, next slide when we get to that point, Nicole, thanks. Also, for everyone's benefit, this is being recorded, and a link to the recording will be emailed to everybody that signed up for the webinar afterwards. There's a Q&A tab, which some of you have already found at the bottom of the screen. We encourage people to ask questions or make comments as we go. We probably won't address those comments unless they're absolutely vital that we do so at the time. We'll probably wait to the end when we finish the presentation and the talk, and then try and produce some good debate at the end, where we will address questions and also any other questions that come at the end, in addition to the ones that have been asked throughout the presentation. We will address, and then at the end, after all of that, we will produce an FAQ document that will circulate again to all the people that signed up, sort of summing up questions and answers we gave. So without I guess further ado, because you'll probably, how do I start a webinar today and not mention the weather? Thank you very much for tuning into this webinar on a very hot day and not sitting in a paddling pool on your balcony or on your garden, keeping cool. That's very nice of you to do that. And actually, I've just seen flash on my phone, we have just broken the record for the hottest day on the record, which actually I think we'd have all been rather disappointed given all the media attention if we hadn't done that. So well done us for being incredibly hot. So Nicole, off we go. So I've done that bit. That's who we are. We can probably skip on. So what are we going to cover? I think most people, I would assume, tuning into this webinar will know what a FitNote is, but we're going to do a little bit on that because there is some relevance to that, and a bit of background and purpose to what we're talking about. We're going to try and give you an overview of the key changes to legislation recently on FitNotes. We're going to talk about the changes that have been brought in around certification of FitNotes and who can do those certifications. We're going to also, I think, try and talk a bit about what we think some of the good things might be as a result of this change in legislation, and some of the advantages that this will bring, and also highlight some of the challenges that we see coming down the road as a result. Try and address some of the things from an employer perspective that you might need to be thinking about if you're an employer dealing with these changes. And then finally, maybe just a bit on the role of where occupational health fits into these changes and how we see our industry and certainly us as a business being able to help customers and people going forward with some of these changes. So that is what's in store. I think without any kind of further ado, we can hand over to the trained doctor in the room who's going to tell you what a FitNote is in detail. Gareth.
Thank you, Alex. Yes, so what is a FitNote? I'm assuming that most of the audience will be aware of this, but just for further enlightenment, I suppose, a FitNote's an official statement provided usually by a GP historically to patients as a proof that they are fit or unfit for work, essentially. Usually provided when an individual has been off work for more than 7 days, and it allows employers to consider paying the statutory sick pay or company sickness benefit. In the changes made back in 2010 resulted in certain adjustments being suggested. So from becoming the sick note, it became the fit note. And sometimes in that, the fit note would record details of the functional impact of the patient's condition to help employers and employees with their conversations about assisting returning to work and suitable adjustments, hopefully, if they were needed. So you can offer advice and recommendations on adjustments, and usually focuses more on what the employee can do rather than what previously was suggested. The sick note was more what people couldn't do, and it just kept them off work. Can we have the next slide, please, Nicole? So just some historical background. Sick notes first started back in 1948 with the setting up of the NHS, and introduced as sick notes Med 3 or Med 5s, if people can remember those. And they've been in use since 1948. Dame Carol Black carried out a review and produced a report called Working for a Healthier Tomorrow back in 2008, since which there were some changes which resulted in what we now see as the fit note. And other comments that are sort of pertinent to our discussion and the background to this is it is well recognised that once somebody has been off work for a prolonged period of time, the longer they're off, the less likely they are to be successful in returning to their role, or indeed even returning to any form of work in some cases. I think the stats are that if somebody's off for more than 4 weeks with musculoskeletal problems, for example, there's only a 20% chance that they will return to that employment. Once somebody's off for more than 6 months, those figures increase dramatically to less than 50% will return to work. It's also recognised that good work is good for people, especially their physical and mental health, and therefore trying to keep people in some form of employment is good for their recovery and generally good for everybody's well-being. So the fit note, in essence, was developed to try and help support people returning to work somewhat sooner than was previously happening. And it is now generally accepted that you don't need to be 100% fit to be able to return to some form of work. This may not necessarily mean somebody returning to their normal job, but a role or their usual job, but with certain adjustments. Next slide, please. So I think this is where Alex takes over for a few slides.
Yeah. So I think, Gareth, you just mentioned some of these things, but with over 90 million fit notes have been issued since 2017. And I think it's fair to say, despite the best of intentions, the reality hasn't quite lived up to expectations. And the idea of a fit note is to, when Dame Carol did her review, it was to try and encourage practitioners to recommend adjustments and to help people get back into work. That's the reason one of the reasons the name changed from sick note to fit note, is to try and encourage people to be able to work. But in reality, 30% of fit notes are issued for 5 weeks or more, which seems to me, as the CEO of an occupational health company, to be a pretty long outlook for an initial fit note to be issued for an illness or a sickness. And 20% of employees who are off for 5 weeks or more never return to their role. So that's pretty stark. It doesn't mean they don't, I guess, go to do other things potentially. But if you know that 30% of fit notes are issued 5 weeks plus, and then therefore 20% of that 30% don't go back to the job they did, something's not working, you would argue. And that's obviously later on we'll talk about the role of occupational health and how that might be able to fit into that. But obviously that means that I think what we're trying to do is look at what these changes might do to potentially improve the fact that the maybe fit for work section that is in the fit note is only used in 6% of cases. I'm an employer as well as a CEO of an OH company. So I employ in the region of 700 people, and I share the same frustrations that I think many of you on the webinar tuning in will feel around the number of times a fit note is simply historically just signed and given to the employee without much scrutiny and doesn't necessarily help move things on. It is not a great indictment of the current system. I'm sure Dame Carol, when she did her review in 2010, was hoping that the fit for work, so the maybe fit for work section in the fit note would be used more than 6% of the time. So clearly, what's been going on for the last decade or so, we would argue, hasn't been working particularly well, and the stats certainly back that up. Next slide, please. Where are we? Is that there we go. Is this the next slide? Okay, good, excellent. So we thought we'd have a bit of fun here, try and get some audience participation, despite it being 40 degrees outside. I hope you've got the energy to use the tool at the bottom of the screen. Just wanted to see what the audience felt around some of these things, and put your knowledge on fit notes currently to the test. You can answer true or false to these questions. So and you should see a poll popping up on your screen. True or false? Fit notes are only used to sign people off sick. Is that true or false? If you could just vote now. Second question. An employee needs a fit note in order to return to work following sickness absence, or bout of sickness absence. Number three, you have to wait for a fit note to expire before allowing an employee to return to work. And finally, an employer is obligated to accept the advice stated on a fit note. And it'd be just interesting to see, and bear in mind, I guess the audience is quite a sophisticated one if you've tuned into this webinar, so it may be that there's a lot of correct answers out there, but it'd be interesting to see. Nicole, I don't know how long that takes. I'm a bit
yeah, people are just almost got 82% of people have taken part so far. Give it a couple of seconds. Right, we'll end the poll now. And yeah, it is a sophisticated audience. We'll share the results.
Good.
Okay, you should be able to see that, Alex.
Good, yeah, got it. So we can see, we were hoping that the vast majority of you would answer. Well, the answer is they're all false, is the overall answer. And you can see that number one seems to be an easy question, with only 7% of you saying true. It is false that fit notes are only used to sign people off sick. They're obviously used, as well as I've just been saying. Ironically, the 7% matches nicely with the 6% from the previous slide that is only used in the section to describe how someone may be able to return to work with some adjustments. So maybe that says something about the average. An employee needs a fit note in order to return to work following a sickness absence. That is false, and most of you knew that, 92%. Slightly less of you knew that you have to wait for a fit note to expire before allowing an employee to return to work. So it's pleasing that we've now educated 60 people in actually you can have someone come back to work and they don't necessarily need a fit note to do so. So that's good news. That means that will help you in your running your businesses. And an employer is obligated to accept the advice stated on a fit note. This is really interesting, and this is really later on when we talk about how occupational health can benefit businesses over and above the advice given to people by their primary caregivers, whether they be GPs or nurses or physios or whatever. 31% of you still think that you're kind of obligated to accept what is written on a fit note. That's not the case. You are able to accept advice from other people, and certainly our experience has been that businesses would tend to, if they do have occupational health in their business, they would tend to place most sort of credence in the advice given by the occupational health team, and which normally does use the fit note as a launch pad to do that. And we wouldn't ignore, in many cases, a fit note, but on some occasions, we do diametrically disagree with what the fit note says. And in those cases, we would advise employers to take our advice as an occupational health specialist over that of the fit note provider. So hopefully that's been useful. I think the last question certainly shows that there is some education to be done, so that's good. Next slide, please, Nicole. Gareth, I think, going to give a little overview of the key changes to the legislation as they stand.
Yeah, so what's recently changed as far as fit notes are concerned? The government came out on the 10th of June and stated that from the 1st of July, fit notes in England, Scotland, and Wales could now be signed by various other allied healthcare professionals other than GPs. There were some changes in April where it was acceptable for digital signature to be used on fit notes, so that was meant to quicken the process up a little bit. But the major change is from the 1st of July, these other health professionals could sign fit notes. So what does that mean as far as those various health professionals are concerned, such as the nurses, physios, pharmacists, and things like that? Up to now, obviously, that they've not had much input theoretically into assisting people back into work. What is now said is that these healthcare professionals must have the relevant training and knowledge to make an assessment of a person's fitness to work. And examples may be, for example, somebody who's initially possibly seen their GP, been referred by the GP to a physio. Physio's seen them 3, 4, maybe half a dozen times and has decided that they're now much better and can return to work with some adjustments. That physio can now sign them back as fit to return to work with the advice as they deem appropriate. It saves the issue of having to go back to the GP and the patient having to present to the GP again, and in effect waste the general practitioner's time when somebody who has had particular dealings with their case and manage their case on an ongoing basis. One of the important factors is, as I've mentioned, the healthcare professionals must have relevant training, and the legislation states, and certainly the professional bodies supporting these allied health professionals indicate that people signing fit notes, such as physios and registered nurses, need to work within their scope of practice and their competence. What does that essentially mean? In essence, it means that only those working probably directly within general practice or hospital settings will be able to sign these fit notes. It doesn't mean that individuals can shop around, go down to the local chemist and say, well, I've got a bit of a back, you're giving me some ibuprofen, can you sign me a fit note? So the local pharmacy won't be signing them. There are some confusions, however, insofar as if somebody's being treated in a private hospital under the NHS, which does sometimes happen, for example, knee surgery or something like that, the physio treating them at the private hospital, if they're on the NHS, can sign the fit note. But if that patient has purely been seen on a private basis, that physio can't sign it. So there's still some confusion and clarity to be got as to who can and what and when people can sign fit notes. And I think that will become clearer as time moves on. So as I've said there, fit notes cannot be issued on request or over the counter. It does mean that employers don't need to look at making any changes to your company's sick pay or internal processes, but you may need to educate line management and those who would normally previously have accepted fit notes that these changes have taken place and you will need to accept fit notes from other healthcare practitioners such as nurses, pharmacists, physios. And theoretically, they should have as much credence as if a GP had signed them. Next slide, please, Nicole. So why have the government and DWP come out with these new changes? You may be asking yourself, and I think one of the major, well, there's two main points I'd like to make on this. One is we're all aware of the pressures GPs have been under. Trying to get an appointment at your GP surgery is almost impossible these days. That's not me knocking GPs, that's just the way healthcare is at the moment, with reducing number of GPs retiring early. So access to GP is one issue. The second one is that the provision of healthcare, the model of that is changing and changing quite dramatically. There's recent GP review on the provision of healthcare, and it came out and recognised that there is much more of a multidisciplinary approach to the management of patients and their illnesses. So you've got people like practice nurses, mental health nurses in the community, for example, physios managing chronic long-term health issues and having more input than GPs, in fact, on managing these individuals. So the DWP essentially have come forward with this change in legislation to try and streamline the process of obtaining a fit note and reducing the pressures on GPs. As I've mentioned, it does mean that it should free up some GP time in that people no longer will have to go and see the GP if they've already seen somebody like the physio or the community mental health nurse, for example. So increasingly, the focus is on allowing these practitioners to support and be proactive in managing their own health and well-being. And it's also one of the points discussed has been, usually during a GP consultation, that the work is very much a last minute as they're leaving the surgery conversation, if you like. They'll present to their GP, talk about their health issues. The GP will discuss the symptoms, discuss the management, talk about the treatment of the condition, and then just as they're getting up out of the chair, they'll say, oh, and by the way, doctor, I need a fit note. Well, that leaves, bear in mind, GPs usually have 10 minutes or less for a consultation. That leaves very little time for an in-depth, proper conversation about the workplace. Although I accept there are several GPs out there who are very good and good advice is produced on fit notes, but the ability of, for example, a physio who has far more input and support with the individual with the back pain, they can have the conversation at an earlier stage and that be part of the management and treatment of the condition. So that's what I think why the changes in the fit note have been brought about. Next slide, please. So Alex, I think you were going to talk about this.
Yeah, so I mean, you've mentioned some of them there, Gareth, actually sort of overlapped. But I think one of the things I like about this change is I think there's been I'll give it, going back in history a bit here, but I think the country, a bit of a philosophical argument, I think the country since the Second World War, in 1948, when we brought in the NHS, the National Health Service, with the idea that we can provide care to people from the cradle to the grave, was the idea when Anaya and Bevan first came up with the NHS and pushed it into policy and into action. That had lots of brilliant things that came with it. One of the sort of slightly unfortunate, I would say, offshoots of that or results of that has been that we as a society, I think we tend to feel that health and looking after ourselves and looking after our health isn't our problem. It's the problem of the NHS. And that's, in the past, that was something that people felt if they broke, then they would be fixed because we've got this wonderful healthcare service. That sort of mindset, I think, is old fashioned and needs to change. And individuals need to take responsibility for their health. And organizations and employers need to take responsibility for people's health. And I'm getting to the point here, which is, therefore, I think it's a good thing if we're taking the responsibility away from solely GPs to be commenting on fit notes and actually involving other practitioners who may have experience of working with that person, may have an in-depth knowledge of their condition. For instance, if someone has injured themselves musculoskeletally and is under the care of a good physio, that physio, if they've seen him 3 or 4 times, is very likely to have a much better idea of what adjustments could be made in the workplace for somebody based on the condition than maybe the GP would, who'd seen them less. And actually, physiotherapists tend to have a very good sort of functional capacity, skill set, and would potentially put more information onto a fit note than maybe in the past we would have seen. And therefore, we're sharing the responsibility of people's health around, and we're actually we're giving more avenues for people to take responsibility themselves for their health. And I think shifting the burden, as we've said here, and Gareth's already mentioned, away from overstretched NHS doctors can only be seen as a good thing. I think a lot of clinic time gets taken up with people only turning up to the clinic to get their fit note, and I think that those people will therefore have other avenues, as Gareth mentioned, the pharmacist that maybe is attached to the surgery, or as I've already just said, if they're already under the care of another tertiary carer, such as a physiotherapist or an occupational therapist, as a result of that surgery's or that hospital's team, then that will shift the burden. It means that GPs can actually see people that they really need to be seeing, and that might mean that when we call up the GP surgery at 8 o'clock in the morning, can actually get an appointment. I think there's also been, just before they announced these changes, there has also been a drive to bring in some online digitization of the fit note process. I think there's now an ability to use in some places an online system to access it, which is a good thing. And then we've put here, it reduces the bureaucracy in the healthcare system, that other health professionals can engage with patients on matters of work and health without having to then reroute requests back into a GP. I think the question, I've just been glancing at the questions on the side, and one of the questions was, if they see a physio or a pharmacist, do they then have to get re-signed? Do they have to then send it to a GP or vice versa? The way this system's designed is to make sure it's one-stop shop. So you go to see that professional and they sign you off or sign you back to work. And that should make the system more streamlined. And it should also mean if they can get access to their fit notes quicker, because I think we've all experienced sometimes delays with people coming back to work, or people being able to be moved forward from an absence because they actually can't get access to the fit note because the GP is busy. This might now mean that speeds that process up, and people will actually find that the bureaucracy of the system that's holding a progress of an absence up can actually be eased by the more availability of resource to do it. And as I've said, I think that the biggest one is some of these practitioners should have a very good understanding of the person's condition if they've been treating them, and therefore they may actually be able to provide, and this is the big one for me, and I've mentioned it already, better advice than we've perhaps been used to, which should mean that then if you do couple things with occupational health and then get occupational health to move things forward in the future, the more detail we've got from a practitioner that's been working with somebody's illness or injury prior to being information result for our customers and for the employees. So and then that will obviously promote better conversations between about health and work between employers and their people, because there'll be more information, and there'll be better information, and there'll be faster information. So those are all the things we hope we will see as an advantage, but it remains to be seen. Fingers crossed. Next slide, please. Gareth, I think you're going to do the challenges.
Yeah. So so what are the challenges that we think we may, or you even may find with this the changes in the fit note? I think there is already some issues about confidence in what GPs are putting on fit notes. So adding other healthcare professionals onto the cohort who can sign these fit notes may cause some discomfort. I think it's accepted that there is some inconsistency in the quality of information provided on fit notes when just GPs are doing it. By adding even more people onto it, I think the threat, the danger is, I suppose, there will be continued and even more inconsistency, but hopefully with some of the education and training that's put into this, that'll hopefully be circumvented. One of the major issues I perceive is there hasn't been great communication from the government about these changes. I don't know about it from an employer perspective, but certainly from a personal occupational health perspective, and even speaking to my two sisters who are both pharmacists working in different settings, neither of them knew these changes were afoot. To be honest, I'm not expecting one of them to be able to sign it because she works in a local high street pharmacy store, whilst the other one works in a private hospital providing oncology care to patients. Now, that second sister, I would have thought may be eligible to sign the fit note, but she hadn't even heard of the changes. So I think there is a general issue about lack of communication and rolling this out somewhat more quickly before the training and education and communication has caught up, to be honest. I've mentioned the inconsistency already amongst doctors when it comes to decisions about fitness to work. GPs report the issue of being the patient's advocate, and in effect, they are there to help support their patient. They're not there to help and support employers as such, and feel that they should be advocating on behalf of their patient. And they also sometimes feel under duress and pressure to, if the patient demands it, to provide them with a fit note without questioning why they're providing it. I know some GPs will confront that situation, but sometimes it's easier in a busy GP surgery to just sign the fit note and get the patient moved on, so to speak. Training and experience in work situations and environments, occupational health experience is very limited, even amongst GPs. Some GPs do have interest in occupational health, but the majority do not. And similarly, the allied healthcare professionals such as nurses, physios, OTs, pharmacists, they will not have received any formal training or education in occupational health or workplace issues. Physios are probably the better suited to this sort of offering advice of this nature, I would have thought, because of their ability to carry out functional assessment and advise what people can and cannot do. Whereas I think pharmacists, I'm knocking my sisters now, aren't I? I shouldn't do that. Perhaps haven't had the education or training in fitness for work. There is the training that's now been put in place by the DWP is an online training package. It probably only takes a few hours to do, compared to the number of hours that an occupational health practitioner, whether that's a nurse or a doctor, will have undergone to be able to provide companies with advice on adjustments and support in the workplace. Talking about mental health condition, it's recognised that the individuals with anxiety, depression are less likely to be assessed as fit for work compared to those with physical conditions. I think there is a danger. I mean, I think what we're saying is these are some of the threats that we need to consider and think about, and you as employers may need to also consider as well. Is there's some of the changes in the personnel providing the fit note may escalate the problem of how long people are off work, and as Alex and I've both said previously, once you're off for more than 5 weeks, it's a case of diminishing returns and helping people back to work. The other point is it's all very well saying nurses, pharmacists, physios have all the time in the world to fill in these fit notes, but I guess they're as time pressured as GPs in effect. Waiting lists to get into a physio, for example, on the NHS must be 6 to 8 weeks or so. One of the things I've not mentioned previously, but the DWP advice is that it's only physios based in GP practices or in hospital environments that can sign these. So your local physio who offers private care down around the corner is not expected to be signing fit notes. So lastly, on this slide, the issue has always been that GPs rely upon what the patient tells them. That's not knocking GPs, but that is the situation. And if a patient tells them that is what their work consists of and that their employer can't put these adjustments in place, the GP is not in a position to question that. And often the GP nor the patient know actually what you as an employer would consider to be reasonable as far as adjustments and support are concerned. So I think, again, that's another challenge. Next slide, please, Nicole. So what about your considerations as an employer? I think it's always been recognised that there is a potential misuse of fit notes, with people being provided with fit notes when employers think that they're actually fit for work. Having said that, if the note is signed by a physio or pharmacist who has access to the medical records and has been assessing and managing that that employee, I think you're going to have to be very careful in addressing that and confronting that with the employee. I think you have to recognise that if by confronting the individual employee, that's only going to raise angst somewhat, and the concerns that the employee will feel mistrusted, and a potential breakdown in your working relationship with that employee. So I think you're going to have to be careful if you think the fit note hasn't been correctly completed, and people are being kept off sick longer than what you'd expect. The other consideration is what we describe as a cultural shift, in that it will take time, I guess, for employers, line management particularly, to realise and accept that a fit note from a pharmacist is just as valid, so long as that pharmacist or physio or allied healthcare professional has assessed the individual and has access to medical records. So I think there will be, it'll take time, but I'm sure we will get there. It doesn't, from the employer perspective, it doesn't mean that you need to change sick pay policies or internal processes as such, although you may want to review the wording in such policies if they do, for example, the wording in them states that only a GP note is acceptable. So you may want to review policies, but that should be a simple change for you. As it mentions there, you need to educate line management or whoever is responsible for dealing with fit notes within your organisation. Make sure they are aware of these changes and that they are supported. And as I've mentioned earlier about the need to avoid unnecessary conflict within the business. So to try and avoid confrontation with employees. Having said that, if as an employer you're unsure or feel that further advice is needed, in effect that's where occupational health fits in. You know, you would understand as employers the commercial needs of the company, and I would hope that occupational health, if you do have that provision, would have an understanding of how your business operates and what adjustments can be reasonably accommodated. Next slide, please. So just thinking about, I'm not going to read those statements out. I mean, people at the Care Quality Commission have come out with statements about these changes, as have the National Institute for Health and Care Excellence. There are other bodies as well have come out with comments. In the main, they're all very positive in recognising the multidisciplinary approach to healthcare now, and that allied healthcare professionals often have a greater understanding and input into the management of patients' well-being. I know the Royal College of Nursing, the British, I can't remember, the Chartered Society for Physiotherapy have come out with statements that are very positive about these changes, but they are all very cautious in indicating that individuals at the allied healthcare professional does need to be acting within their scope of practice, and they do need to have had the appropriate training. So I can see that although these changes are in place, I think it will be a trickle to start with, to be honest, and it will take time before these other healthcare professionals have had the appropriate training and will feel comfortable that it's under their scope of practice. I think one of the questions asks about the timescales. You know, if somebody's had a relatively newly qualified occupational therapist who's less than 2 years in practice, will they be able to sign these? As far as I understand, there's nothing in the legislation that says they can't. What they must do is act within their scope of practice and their competence. And if they feel they're competent to advise on workplace issues and matters, then yes, they can. But I would understand the concern that somebody who's fairly newly qualified was signing these fit notes off. I guess from an employer perspective, you won't know how long that person's been qualified for or not. So I think you'd just have to accept it. Yes. So next slide, please, Nicole.
That's me, is it?
Yes, I think so, Alex.
Yeah. So look, we'd be remiss of us not to mention how occupational health could link into all of this interesting conversation. I actually hope that these changes will be positive for. Let's go back to why we do fit notes. We want people to be at work. We want people to be able to do their jobs. We want employers to be able to access the right advice. It'll be excellent if these changes, as we've already discussed in this webinar, can mean that there's less stress on the GP system, better advice is given, more expert advice is potentially given from other practitioners that know the individuals. And as Gareth says, whilst that may be a trickle, if it can develop into a stream and then a flood in the next few years, that in and of itself means that we will have a better chance to reduce these enormous numbers of, in 2021, for instance, 149.3 million working days lost due to a sickness absence. You know, that stat in and of itself, the stats we gave at the beginning around only 6% of fit notes containing any advice about returns to the workplace, the historical performance of fit notes. So we would hope that, you know, that these enormous numbers you can see on this slide will start to reduce if these changes have the effect that we've described and we hope they will have. That doesn't mean, however, that the role of occupational health diminishes. In fact, I would argue it increases the role of occupational health, because if the occupational health is starting from a better standpoint, as Gareth said, you know, he rather modestly mentioned that he had a bit more training than a 2-hour course on fit notes for these practitioners. Well, I think, you know, some doctors can do 7 years more training than once they've qualified as a GP in various disciplines in workplace health. So there's a lot more training, and therefore that expertise doesn't go away. And I think that if they're starting from a better standpoint with more information on the fit note, a more constructive and helpful fit note, whether it be signing someone off sick or signing someone back to work, that's a good standpoint from which to launch occupational health, and to have occupational health take the baton on and really help businesses make better decisions for the health of their staff. It is still stark that only 50% of employees have access to occupational health in the UK. That's not enough. Occupational health really, even with, you know, in fact, going back a few years, that was even less of us, that was even smaller. So we are starting to see real awareness for health and well-being in the workplace. COVID has accelerated that, but, you know, historically, for instance, smaller businesses, SMEs, had very little access to high quality occupational health, because there was no awareness, and there wasn't the structures in place to do that. That's now changing. We're trying to address that ourselves with various products to try and help smaller businesses. So I think to try and take the burden, talking about what I mentioned earlier about responsibility for people's health, for responsibility should come away from the state and into individuals, and certainly into employers. So where people, you know, if we've only got 50% of people using occupational health, that means that everyone else is still relying on GPs and the NHS, which is what's causing one of the reasons we've got all these enormous waiting lists and backlogs in GP surgeries. So occupational health can really step up and fill that gap. Next slide, please, Nicole. And I think Gareth's touched on some of this, but these guys are specialists. Occupational health people are specialize in the relationship between physical and mental health issues and the workplace. And the guys that are signing fit notes, most of them, and I know Gareth's already mentioned this, but with the best will in the world, don't have that knowledge of the workplace. When we take on customers, we develop an in-depth knowledge of their environments, of the areas of their workplace that we come and learn about, and we speak to managers, we speak to leadership teams, we understand the adjustments that they can accept in different roles, and we develop a picture that isn't just about the patient's condition or the employee's condition. It's about the condition married in the round to the job they do and the company they work for. And that means that direct relationship between the employer and the occupational health team, and the employee, that triumvirate of people can come up with the best solution for the employee, the employer, and the health of the employee, but also the ability of the employer to make adjustments and to put them in a position that is going to create a good situation for everybody. That's very, very hard for a GP or a physio or a pharmacist to do. Occupational health can do that, and you'll get the best results. If you look at average absence rates, if you can get an early referral into occupational health, the stats show you that you can massively reduce weeks of absence, but can become days of absence. And that probably isn't the case if you're signing someone off with a fit note for 5 weeks, as we saw at the beginning, and that will still happen, albeit these changes hopefully will improve that. That will still happen. Occupational health can step in early. If someone's been signed off with depression for 5 weeks, we would advise all of our customers to make referrals immediately into occupational health, so we can really help that individual quickly before the condition either gets worse or is misdiagnosed at that initial point when the fit note's signed. So there's much more competent and pertinent and comprehensive and pertinent advice that will be constructive for employers coming from occupational health, given by clinicians that are trained to do so and have many years of postgraduate qualifications in doing that. And also, the advice we give is impartial. Many times we're telling employees that they can go back to work and with certain adjustments, and that's the advice we give. Sometimes we're telling employers they need to change the way that they're treating employees and they change the environment they're creating for employees. We'll just do what's the best solution for the employee's health and to get them back to work as quickly as we can. And actually, that's where I said earlier, fit notes can act as a trigger for that process and can act as a suitable referral point. And that's certainly the Society of Occupational Medicine stance, which we share. But now, if you can get more information on those fit notes and there's more detail on them, then we'll be able to start from a better standpoint. The referral will be better, and the job that occupational health does will be better. So that, in summary, is very quickly our view. So just to let everyone know, we've had it's been a great response. We've had, I think, something like 60 questions. So that actually, what we might want to do is just address a couple of them now, but what we'll definitely do is we said at the beginning, we'll do a Q&A, we'll list all the questions and we will answer all of them. I think, having kind of been glancing at them whilst we've been talking, trying to keep abreast of both, I think we probably know the answer to 90% of these things, and we'll have to research a bit on the 10%, but they're really, really good questions. And so Nicole, I don't know whether you've picked a couple to highlight.
Yeah, so there's quite a few common themes. One of the themes is around the fact, do we feel that this will stretch into the OH clinician environment in terms of, will occupational health doctors and nurses ultimately be able to sign fit notes at some point? Or can this happen now with the new changes?
Can I answer that, Alex?
Yes.
I don't think it's our role in occupational health to sign fit notes, to be honest. The other point is the DWP and the advice that comes along with the legislation is that people signing fit notes in whatever capacity they act as, whether it's physio, nurse, pharmacist, have to have access to the individual's medical records. We in occupational health do not have that access, so we will not be able to sign them. So I think it's quite important to get that message out there, that it will be people responsible for managing and treating individuals' healthcare that can sign the fit notes.
Just to add to that, Gareth, I think that's absolutely right, because we don't have the access to the national database of records, so that's the reason we can't do it. But if we're talking philosophically or ethereally about the future, I can see a scenario in 10, 20 years' time where government has realised that occupational health specialists, the specialty of occupational health, and practitioners that are solely focused on the ability of people to do their job will become more required. And that will also mean training other types of clinicians. So I think the awareness of health and well-being in the workplace is becoming much, much bigger across all employers and government. And as that happens, you could see a scenario in many years to come, potentially, when that cohort of people do actually take on this type of responsibility, or in fact, whether or not you need fit notes at all at that point, because you've evolved to something entirely better that might be a lot more constructive and a lot more proactive to prevent, illness and sickness in the workplace from happening in the first place, to avoid the sicknesses and so on. So I think we'll see an evolution of this.
The other point I'd make, Alex, is I think it was mentioned earlier about accepting the advice. Do employers have to accept the advice that's on a fit note? Yeah. No, they don't have to. They can take advice from occupational health, which may contradict the advice from the GP. And there is case law that recognises that occupational health will have a better understanding of the workplace. And therefore, if employers prefer that they've got an option, basically, do they accept the GP or do they accept the occupational health advice if it's contradictory? That's a management decision, if you like, but there is case law that says occupational health advice will trump that of the GP, because we have a better understanding of work and health and impact of health upon the work.
Thanks, Gareth. That's actually covered quite a lot of people have asked, that really essentially, does OH clinician advice trump fit notes, which there's a lot of questions as well, which I think you've kind of covered, but just again to say, what is the rules around training for this? So are pharmacists, physios, are they ready to go, with this new legislation? But I think you've sort of touched upon, I don't know if you want to sort of touch upon that a little bit more.
I'll just add a little bit on that. There is basically an online e-learning platform produced by Higher Education England called ELFH. That's where the module is on, and that's where people are expected, if they're going to be signing these fit notes, that's where they will access their training. There is a question about some supervision, and who's going to, will the GP supervise people to start with? So there is a little bit of confusion and a bit of lack of clarity in my mind as to how do people go about training. Yes, there's an e-module online, but is that really satisfactory?
I think, just to add, you made the point earlier, and I think it's right. I think this change has been brought in with the best of intentions, and for a reason. Actually, I think we are, if not at complete crisis point, we're at a very severe state of distress when it comes to the GP primary care system. So this has been brought in to ease that. The communication of it has been poor. There's no really any way of getting around that. It almost sort of appeared as an sort of under the radar, thing, which will mean both. That's why we're doing this webinar for employers because on the two fronts really. Firstly, therefore, a lot of the practitioners won't have done the course and aren't aware, as you demonstrated with your anecdote about your sisters. But also many employers and managers won't know that this is a thing. And therefore I'm worried that there's going to be scenarios created where you've already got, for instance, with people that may have some mental health issues, getting signed off with this new system, having that fit note rejected by their employer in error because they don't recognize it or haven't had it told to them, and the government hasn't explained it. That then may cause illness, because if people get stressed about the process, that can often cause further complications. So I do think, if you listen to this webinar today, the first thing you do need to do is go back and communicate clearly and transparently to your people and your staff about these changes, so managers and everyone accepting fit notes do know that it's valid and that it's the right thing to be doing at the moment. I guess our frequently asked questions document will help you do that when we send you that post this webinar. So I think communication has been poor, therefore that is linked to training. But I think, and Gareth, you referred to it as a trickle, hopefully once the message gets across and more people do more webinars like this, there'll be more awareness, and the training will get more mainstream.
Quite a few people have asked, this might be one that we need to research. I'm not sure, Gareth, you might be able to shine a light on it, in terms of, will the fit notes look the same? So will the fit notes being issued by physios, pharmacists, will they look the same as the fit
far
note?
as I understand it, they look very, very, but exactly the same, apart from the signature will be by a physio or whoever, as far as I'm aware.
A few people have also asked, does the initial fit, I think you've covered this, does the initial fit note have to come from a GP and then it can be other healthcare professionals after that?
No.
No, it doesn't have to be the GP to start with. It could be, you know.
Quite a few people have asked that question. There's a few people have also asked, is a key concern is accepting fit notes from overseas. What are the rules for accepting overseas? As this person's policy is that we would normally ask employees to get the fit note verified by a GP if we're concerned about the authenticity.
I think that's the company policy, I would have thought, rather than a medical issue, to be honest. I mean, we do question sometimes the authenticity of fit notes from overseas, but I'm not entirely sure on that one, Alex. Have you a view?
No, I mean, no, I that's a new one, but I would suggest if your practice had been getting them to take that fit note to their GP to get it verified, then you would then, following on from that, logic would say you could now take that fit note to any of these practitioners and get it verified, or at least, you know, have a new one issued if you're not happy with, if relevant. But no, I mean, the other thing is, obviously, if you've got occupational health in that scenario, you could ask occupational health around the condition or the overseas fit note as well.
I mean, we're coming up to the end now, so we've still got quite a lot of questions flooding in. So it would certainly be an FAQ document. We have had lots of people, thank you very much, say it's been really useful, very interesting. So thank you, Alex and Gareth. In terms of a kind of final themed question, a few people have asked about waiting times. So currently, if somebody needed to get a fit note from their physio and there's a long waiting time, would they be able to go to another healthcare professional in the meantime?
Yeah, I mean, that is a general issue with NHS, isn't it? It's waiting times, whether it's the GP, access to the GP, it's whether NHS physios. I can only comment that the way the DWP have set this up is it is GP practices and healthcare practitioners working within those GP practices in the main that will be able to sign these. So if there is a wait, there is a wait.
Yeah,
I don't see anything changing there, unfortunately.
No, I guess the way of kind of answering that as well would be to say it's just numbers. If more people are able to do it, you would hope, therefore, someone will be free, and it not just be you know, waiting for that one individual. Someone just asked, Nicole, I just thought I'd answer this one. There's been a few of these. Someone has asked if they take the advice of an occupational health professional over the GP or physio or pharmacist's fit note, and then something were to happen or something were to deteriorate or there'd be an issue, would they not be liable? I think I just want to answer that, is to say the answer is no. Obviously, any occupational health provider that's reputable and that knows what it's doing and has been properly contracted with you will have safeguards in place and insurances of their own if they do have, you know, all practitioners have professional indemnity insurance and negligence insurance anyway in the worst case scenario. But in terms of, you know, if things were to go to an employment tribunal or any kind of south-facing route where if something's not going very well, it's very unlikely someone's going to take the medical opinion of a physiotherapist who spoke to somebody for 5 minutes over a fully trained and accredited and 7-year trained occupational health physician or nurse who specialize in that work. So, and we say that to our customers all the time. It's very important, I think, because I do think there is a lot of fear out there that people feel that if they go against what the fit note says, and actually that the answer to our question in the quiz, that was the one that got the most wrong. That is a misconception, and occupational health is definitely here to be the impartial advocate of any healthcare situation in the workplace. So they are the experts, and they would be taken as such by almost everybody. Gareth, I mean, that's correct.
That's correct. Yeah, I can't remember the exact case law, but there is case law.
Yeah.
If on the FAQ, I can dig that out and quote it.
Good. Well, that's probably us, isn't it, Nicole?
It is, yeah. We've just slightly run over, but we've that was great. We've got lots of lovely positive feedback. So thank you everyone for joining us.
Thanks everybody. Try and stay cool. Drink lots of water.
Yeah.
Bye.
Thanks.
Bye.
Bye.
Cheers.